South Korea, meanwhile, has recorded its biggest single-day jump with 851 new cases. More than 5,000 people are infected there now, prompting the president to declare his country is at war with the coronavirus.
Their president says the country is at war. They've passed their training and they're ready to be sent to the front lines. The South Korean President Moon Jae-in inspects the newest recruits as he deploys the military in the fight against the coronavirus.
The entire country has declared war against the infectious disease, as the crisis in some provinces has reached the highest point.
It's a tough first mission. South Korea has reported the most cases outside of mainland China. In the capital, Seoul, drive-through test centres allow residents to get a checkup with minimal human contact, while smaller towns are subjected to thorough disinfection measures. The World Health Organization says the effort is working. The virus hasn't spread to new communities in South Korea.
Well, here in South Korea, the mood among top officials is one of cautious optimism. They believe the president and the health minister saying similar things, that they believe that about 11 days ago they reached the height of new confirmed cases. On that day, more than 900 new cases were confirmed. Since then, we've seen a steady drop, particularly in the past 3 or 4 days or so. We're now down to 131 new cases reported today. And another interesting note, even though this country is described as one of the hot spots, they have more than 7,500 confirmed cases of coronavirus here, similar numbers to Italy and Iran. The death toll here is much lower. Sadly, 54 people have lost their lives to this virus in this country, but that number is much, much lower than the numbers you see in both Italy and Iran. And one of the reasons health officials say here they believe they've had at least some success, they think, is because of the vast amount of testing. More than 200,000 people tested in this country already. 650 places throughout the country where you can be tested, between hospitals, clinics, and these pop-up drive-through centers. I spoke to the mayor of Seoul, a city of nearly 10 million people, about how they've been able to stem the spread to this huge metropolis. Take a listen.
어떤 경우에도 확진자가 생기면 그 확진자의 동선을 재빨리 파악해서 그분들이 자가격리할 수 있도록 조치하고. It shows the numbers of the patient in each hospitals like this. Now, as I mentioned, we are accepting the patients in other provinces. Seoul has more advanced facilities.
So just at the touch of the map,
here.
You can see.
Yeah. Here it shows the hospital name and locations and phone numbers, and it has bed. 또 무엇보다도 빠른 테스트를 보장해서 누구나 의심 증상이 있으면 바로 테스트 받고 바로 확진자인지 여부를 결정하는 것.
Mr. Mayor, what can the United States learn from Korea when it comes to coronavirus?
저는 이 감염병에 있어서 가장 중요한 원칙, 투명한 것, 그리고 신속한 것.
검사 결과는 2일 이상 걸리고 있고요. 결과 나오면 문자로 알려드릴 테니까 결과 나오기 전까지는.
Now we go to South Korea to see what seems to be working in the fight against COVID-19. The government there is spending nearly $10 billion to fight the country's outbreak. As special correspondent Bruce Harrison discovers, money is just part of the fight. It also takes communities willing to come together.
Kim Kyung-soo took off work as a bus driver to pitch in on what's become the national priority here, defeating COVID-19. Now he's volunteering at this drive-through test clinic.
As citizens, we're here for the safety of our fellow citizens to volunteer for Goyang City.
Anyone can pull in with or without symptoms. This local office worker is here just as a precaution. He tells nurses he recently smoked a cigarette with someone who may have been in contact with infected people. After taking his temperature, they say he seems symptom-free for now, but to come back if that changes. Others receive a much more thorough exam based on their physical symptoms and potential exposure to confirmed patients. Thousands of Koreans have driven through this clinic in the past 2 weeks. It's free, takes 10 minutes, and you get results in 2 to 3 days.
Staying sick longer only increases costs and puts people's lives in danger. You must find them quickly, and you must not be frugal about the costs. It's the state's basic duty to support the lives of its people.
More than 200,000 South Koreans have now been tested. Top health officials gathered this week in Seoul to share their results, and they didn't skimp on precautions in a room full of journalists.
With a transparent and open society as the goal, we'll recommend a response system that blends voluntary public participation with creative application of advanced technology.
Text messages alert the public to the location of confirmed cases, and quarantined patients update the government on their health via smartphone app. Seoul has rejected citywide lockdowns and left its borders open to everyone except those coming from the hardest hit region of China.
The consensus among public health professionals seems to be that travel bans are not effective in containing contagious illnesses and can make things worse, even by fueling a sense of complexity.
South Korea partly credits mass testing for its relatively low death ratio among hard-hit areas. The country's ratio is less than 1% compared to more than 4% in Iran and 6% in Italy. And today, during a Pentagon video conference, the top U.S. commander in South Korea also credited testing for keeping COVID-19 off U.S. bases, testing initially done by the Koreans.
They've been extraordinary partners. We've typically got our test results turned around in about 24 hours.
One U.S. service member and 8 others connected to the U.S. military here have tested positive. But General Robert Abrams said strict controls and transparency prevented a larger outbreak. Most Korean cases have been limited to the country's southeast, but recent cluster infections in Seoul may test the Korean model for success.
This testing center was set up specifically for residents and employees of this building where there's been a large outbreak of COVID-19. And as you can see behind me, a gentleman has just sat down. He's beginning the testing procedure.
One area in this neighborhood where foot traffic hasn't slowed is outside of pharmacies. The government has limited customers to just 2 masks a week to make sure healthcare workers get what they need first. Still, there's no panic here as people in this community come together to cope.
I'd like to buy more masks, but I know if I did that, others wouldn't be able to. So, I feel I shouldn't.
I think they're handling it very, very well here. I mean, I was amazed. The signs were up everywhere, on buildings, on every surface. Every time we walk into our hotel, somebody's taking your temperature. Every time you walk into a building, there's hand sanitizer everywhere. So they're taking it, very seriously, being very proactive.
Proactive, yeah. That's we feel actually been feeling safe. Yeah. We're not sure what it'd be like getting back to California.
Hello, we've arrived. SFO, good flight, easy exit, global entry, right, no questions.
No questions.
No questions at all. We just exited. That's it. They did take 3 temperatures in Seoul, actually, right?
Yeah.
And asked us questions whether we were in China or Iran, and then asked us if we were around anyone that might have had the virus. But that's about it. We're here.
Nothing.
On arrival, absolutely nothing. Got our bags, we're out.
확진자 수가 세계에서 두 번째로 많은 나라, 대한민국. 그런데
한국 검사 능력, 와우.
외국에선 왜 이렇게 칭찬 중? 최근 국내 감염자가 급증하면서 걱정과 우려의 목소리가 커질 때 해외에선 오히려 한국을 칭찬하는 사람들이 있었습니다. 심지어 이들은 저명한 의학 전문가들이죠. 이들이 한국을 칭찬하는 이유는 코로나19 진단 능력 때문입니다.
한국 검사 능력, 와우.
검사 결과를 기다리는 사람을 포함해 그들은 거의 2만 명을 검사했습니다. 굉장한 진단 능력을 입증하고 있어요.
현재 국내에서 검사를 마친 사람 수는 벌써 16만 명을 넘었습니다. 다른 나라는 어떨까요? 미국의 경우 진단키트가 부족해 검사조차 어렵다는 지적이 나오고 있습니다. 전 세계에서 인정받는 한국의 감염병 검사 시스템. 이게 가능했던 이유는 관련 기관과 전문가들의 엄청난 노력 덕분입니다. 진단 시간을 획기적으로 줄여준 우리나라의 진단키트는 적자를 각오한 한 중소기업의 노력과 질병관리본부의 빠른 대처 덕분에 개발부터 승인까지 채 한 달이 걸리지 않았죠. 보통 1년 정도 걸린다고 하니 정말 빠른 겁니다. 게다가 자동차로 이동 중에 검사할 수 있도록 드라이브 스루 개념의 진료소를 설치하는 등 검사 시간을 줄이기 위해 노력하고 있죠. 확실히 세계적으로 인정받을 만한 검사 시스템을 갖췄다 할 수 있지만 그렇다고 현재 상황을 마냥 낙관적으로 볼 수는 없습니다. 감염자가 급증하고 있다는 건 명백히 사실이니까요. 금방 끝날 줄 알았지만 순식간에 상황이 급변하면서 정말 힘든 시기를 보내고 있는 대한민국. 그래도 수많은 사람들이 빠르게 대처하기 위해 노력하고 있는 만큼 사태가 하루빨리 진정되길 진심으로 바랍니다.
간단합니다. 그 공중전화 박스 크기의 부스 안에서 환자가 들어가서 진료를 받는 그런 시스템을 말하는 건데요. 그러면 의사와 간호사는 부스 밖에 있게 되는 겁니다. 그러면 일단 직접 접촉을 안 하게 되는 거죠. 네, 지금 부스 안에는 UV 램프가 계속 작동을 하고 있고 강력한 음압 모터가 작동이 되어 있습니다. 그리고 환자가 진료가 마치게 되면 소독과 방역을 하고 충분한 시간 환기를 거친 후에 다시 새로운 환자가 진료 부스에 입장할 수가 있게 됩니다.
전국적으로 71.7%는 집단 발생과 연관된 사례로 확인하였습니다. 기타 산발적인 발생 사례 또는 조사 분류 중인 사례는 약 28.3%입니다. 또 집단시설, 다중이용시설, 의료기관 등을 중심으로 집단 발생 사례가 확인되는 만큼 추가적인 전파를 막기 위해 각 지자체가 해당 시설, 기관 등과 유기적인 협조 체계를 갖춰주실 것을 당부드립니다.
신종 코로나 바이러스 감염증 예방 수칙. 올바른 손 씻기는 30초 이상 비누로 꼼꼼하게 씻어주세요.
Are you anticipating a surge in your questions for Mr. Kwan from the KCDC? 될 수도 있기 때문에 그런 부분들은 향후에 향후적으로도 급성비 유방상이 가장 많은.
그 지역 사회와
Their privacy is respected. 이것이 의미가 있는 차이인지